So no matter what the cardiac emergency is, we are always going to do certain things. And that is we are going to take vital signs, we're going to hook the patient up to a monitor, and we're going to get blood, whether that is from the nurse giving it to us from the IV, or whether we do a peripheral draw. And another kind of complication that a patient can come in with is a blood clot. And that blood clot can be in their lung, or it could be in their leg or thigh. If it's in your leg, it is a deep vein thrombosis, a DVT. If it is moving, it's a it is no longer a DVT, deep vein thrombosis. And once it moves, it's an emboli, and it can become a pulmonary emboli. In this case, if the blood clot moves into the lungs, it is a pulmonary emboli and it can cause death. So again, this is a medical emergency. So this patient would present with both cardiac and respiratory symptoms. So the same course of events, though, we're still going to do the same things and that is the vital signs and getting the patient hooked to the monitor. Some people have peripheral vascular disease, and peripheral vascular disease can cause them to have changes in discoloration in the periphery, so hands, feet, lower legs. They can also have problems such as the heart pump is actually not working properly. And this can be caused because the patient has had a prior heart attack, or they have pericarditis. Pericarditis is an inflammation of the pericardium, and so the heart is kind of restricted. So if a patient has had a prior heart attack, they can develop what's called congestive heart failure. And in this case, the left ventricle is ineffective in pumping blood out to the body, and blood gets backed up. So the patient may have such things as swelling of the feet or ankles or shortness of breath, because the blood is getting backed up from the left ventricle into the right ventricle and into the right atrium, and then backed up all down the system into the feet and legs. So depending on how bad the congestive heart failure is, will determine how bad the patient's symptoms are. And again, they're going to need, vital signs, EKG, possibly oxygen, which the doctor will order. And so you want to do an O2 saturation, and again, get blood. So the blood that we're going to draw, I said earlier, was a MB, a myocardial band, but actually myocardial bands do go to the lab. What we get is a troponin, and troponin is also a measure of whether a patient's having a heart attack. So in the ER, we can do chemistries and we can do troponins at Swedish Edmunds ER. And from the troponin, if the troponin is elevated, then we know that the patient is having some kind of heart damage, and that can be caused by ischemia, which is not enough oxygen, which would be a myocardial infarction, or sometimes if their heart failure is bad enough, they will get ischemic too. So, with all these emergencies, you're still going to do the same procedures, and you're still going to do the same vital signs, EKG, and oxygen saturation, and again, get the blood. The doctor will decide, along with nursing, what is actually going on with the patient, and the provider will order the appropriate testing.